Hello everyone, I'm Dr. Timothy Keenan. Today I'd like to show you the best way to heal persistent hip pain yourself. Turn 45 degrees on the chair, place the edge of a large 4-inch in diameter unopened tomato can in the middle of the hip, lean sideways onto a painful spot and hold for 20 seconds. Then move to the side onto another painful spot and repeat the procedure. This is the gluteus medius muscle. If it hurts yet feels good at the same time, you're doing the right thing. It's so easy, your body weight does all the work for you. Continue for several minutes, then go back and treat the most painful spots again, especially if they burn. The burning sensation is due to the release of stored up toxins and indicates a problem that's been there for at least 6 months. If your hip pain is isolated to just this region, that's all you have to do. I'll now show you what you may have to add to your self-treatment if you have pain in the surrounding tissues. If your pain goes into the middle of the buttock, sit straight, place the edge of the can in the middle of the buttock, lean back onto a painful spot and hold for 20 seconds. Then move to the side onto another painful spot and repeat the procedure. This is the piriformis muscle. If your pain goes down the side of the leg, bend your leg inwards, firmly press the edge of a soup can just below the hip, then slowly slide it down to the knee. Repeat the procedure 15 times, concentrating your efforts on the most painful region and adding pressure as the tissues warm up. Do this 3 times a day. This is the tensor fascia lata. It's that simple. Try it for a week. If you feel improvement, continue treating yourself at the same intensity until you're perfectly healed. If you have less pain when walking and lying down on the affected side, it's proof that you're healing and you should congratulate yourself. If you treat yourself for 15 to 20 minutes a day, you should be completely healed in 2 to 3 weeks, depending on the severity of your condition. When you start, it's normal to have sensitive skin for 3 to 4 days as your body eliminates stored up toxins. Light bruising may be normal for some people. If you're taking anticoagulants, take more time and use less pressure in order to avoid excessive bruising. Never apply heat, including hot baths, since heat increases inflammation. If you've just hurt yourself, you may apply ice for 15 minutes 4 times a day for 3 days in order to reduce the inflammation. You can even do this while sitting in front of the television. If you're sitting on a leather chair, you may want to lay a towel over the chair in order to protect the leather from the edge of the can. In order to accelerate healing, avoid standing on one leg and crossing your legs. Always change sides often when shoveling, raking, or vacuuming. Once healed, if you ever feel the pain coming back, treat it immediately before it gets worse. Finally, in an effort to clear up the confusion surrounding the real cause of hip pain, if you heal yourself using my method, it's scientific proof that your hip pain was caused exclusively by contracted soft tissues, since that's all my method corrects. This means that even if you can see osteoarthritis, what most people call arthritis, bursitis, osteoporosis, spinal stenosis, spondylolisthesis, scoliosis, misaligned vertebrae, subluxations, pinched nerves, a short leg, or degenerated, slipped, thinned, bulging, or herniated discs on your X-rays, CT scans, or MRIs, they have absolutely nothing to do with your pain, so you can ignore them. Only 5% of hip pain is caused by things other than contracted soft tissues, muscles, ligaments, tendons, and fascia, so you have a 95% chance of healing yourself when you use my method correctly. That's all you need to heal pain yourself. If you have any questions, feel free to write me. Bye for now and happy healing.